Welcome back to Echo Diabetes in the Time of COVID-19 series, and we're interviewing patients and healthcare providers who happen to have diabetes. In this case, Nicole King, Dr. Nicole King, who's a pediatric resident, not only has diabetes, is not only a frontline worker, but also had COVID-19. Before you got affected or now kind of after, where there's, who knows, the chances of reinfection, how's this kind of affected your mental health?
In the process of figuring out whether or not I had it, I was probably, a little bit angry and confused and scared, are the really big things. Angry at myself for having this exposure, maybe a little bit angry with my patient too, to be honest. But also, angry at the situation in general. And I think that it's important to acknowledge those feelings. Being scared was another thing, because I just didn't know if I would be a person who would have negative outcomes or not. But I dealt with those emotions throughout my diagnosis by talking to the people around me, and again, the amount of support that I got through the community, through my residency program, and from my family and friends was really astounding. And it really helped me overcome a lot of that fear and anxiety and anger.
Obviously, COVID's nowhere done yet, but kind of what have you kind of learned throughout this experience, and kind of take home points for you as someone maybe living with diabetes, but also kind of on the front lines at higher risk of infection or reinfection?
It's kind of a funny story, actually. So I was quarantining with my husband in this one-bedroom apartment, and I happened to have my regular endocrinology follow-up appointment, and I was wearing a mask in my house, but during this telehealth visit, and my endocrinologist asked me, "Oh, why are you wearing a mask? Are you in clinic? What's going on?" And and I told her, "Oh, I have COVID." And she was like, "Well, that's hilarious and fantastic because your blood sugars actually look better than they did the last time." So I didn't really see many effects, honestly, when it came to the control of my blood glucoses. I was extra diligent, and I do use a closed loop system with a continuous glucose monitor and insulin pump. And I paid extra close attention to what I was eating and made sure to, be thoughtful about how many carbs I was eating. And I also found myself having a little bit less appetite. And so maybe that also contributed, that I was eating a little bit less. But the good news is that everything turned out okay. I didn't, find too many crazy spikes in my sugars or dips. And the diabetes was actually easier to manage because I could focus on it and had a little bit of free time on my hands during quarantine to be able to pay attention to it. I think finding ways to reach out to people to your patients who have that diagnosis, and connect with them and find ways to provide them with that support and sense of community, might be a very helpful way to support your patients. Whether that's, just a check-in, or making sure that they have ways to access healthy food during their quarantine, or anything like that. I think that that's really, what I found most meaningful out of the whole experience, was all the support and thoughtfulness that I got from my coworkers and from my friends and my family, to give me the best chance to have a good outcome. And even, having the mental fortitude to stay positive and tried to really engage in self-care during that time too, um, is really powerful. One of the first things that I didn't think about that could be a challenge for someone with diabetes who has COVID is food. And I think that's really important to acknowledge because if I didn't have the support of my friends and family or financial resources, it might have been a lot harder for me to obtain healthy food uh, in a socially responsible manner. I was fortunate enough to have my husband who quarantined with me, who didn't wind up getting it, which is great, but he was able to, pick up food from it, like a drop off place, or we were able to figure out different ways to get access to food and medicine too. Um, and being able to direct your patients to those resources might be really, really have a big impact on their life and their ability to handle the disease.
So, I mean, people living with diabetes are obviously in one of the high risk categories, and also kind of depending on age in the time of COVID. But even before COVID, there was lots of stigma that kind of goes with diabetes. Do you want to speak anything kind of to stigma and diabetes, kind of now in the time of COVID or before, and maybe some things that you'd like to see change or how it's affected you?
I think a lot of the stigma surrounding diabetes and it being someone's fault sometimes that we hear, especially for type 2 diabetes, but people oftentimes don't have a distinguishment between that. Um, Despite that, keeping in the forefront that it's not this person's fault that they have diabetes, and it's also not this person's fault that they have COVID. One or the either or, I think um, it can be really you can be really hard on yourself if you do wind up contracting COVID, and you can also be hard on yourself if you feel like you're responsible for any other medical condition. So, reminding people that we are there to support them and not judge is really important too. Um, and I think another stigma, like within the diabetes community, can be how well controlled your blood sugars are. And I think normalizing the fact that your blood sugars might not be well controlled, or we might even expect them to be out of whack when you have an illness. Um, by setting that stage for a patient, it might make it easier for them to ask for help or be more transparent about how the management is going during an infection or during some sort of um, uh, obstacle that they are encountering, whether it's COVID or something else.